Yep, and we're also grateful tonight to have on Fatimah Loren Dreier, who's the executive director of the Health Alliance for Violence Intervention. Fatima, thank you for joining us.
Hi there. Thank you so much for having me.
Fatima, we really appreciate you coming on today, especially in light of some of the recent, mass shootings that have occurred in this country, the notable ones that's getting media attention. And we wanted to have this discussion because there seems to be, two different reactions when there is quote unquote mass shootings in America, right? It's the one that we're seeing now that's playing out um, on all our screens, and it's about gun reform and solutions of that nature. But there, especially last year. Let's talk about last year. There was hundreds of mass shootings, perhaps exacerbated by the COVID-19 pandemic, which occurred disproportionately in communities in color, and they were largely ignored by the national media, right? So, can you talk about how community groups are addressing this trauma and this violence, and also sort of the dangers of ignoring this gun violence epidemic that we've had for years?
Absolutely. So first, I just want to again thank you for having me and say that it's really powerful and very tragic that any community, has to reckon with the trauma and the tragedy of losing a loved one. So there is we don't pit victims against victims. Any
Mhm.
sort of victimization is worthy of recognition, acknowledgement, and action, frankly. But what we know is this: um, uh, gun violence is the leading cause of death for Black boys and men. It's the second leading cause of death for Latino boys and men. It leads in terms of death for Black girls and women. So there's a disproportionate response, unfortunately, given the pervasiveness, the burden that we see in Black and Brown communities. And this is something we need to pay attention to. I work for the Health Alliance for Violence Intervention. We want to address racially equitable responses to violence. We particularly stand up hospital-based violence intervention work, which is part of a more comprehensive system of violence intervention strategies that focus on public health. It focuses on, first, we want to identify those who are at greatest risk of potentially being harmed. We provide wraparound care services that ensure that people aren't at risk to be harmed or potentially harm someone else, right? And we continue to monitor their progress and their transformation over time. And these sorts of programs, hospital-based violence intervention, and a whole range of others that comprise this comprehensive system, cities have boasted reductions of 50%, 40% in Oakland, in New York. These are really powerful. So I'm sure many of your listeners and you all might be asking, given this kind of effectiveness, why on earth would this not be the norm? Why
Yeah.
wouldn't we invest in these solutions and have them be a part of our infrastructure? And that, I think, is the very thing we contend with, because we think that there's this kind of sense that it's normalized in Black and Brown communities, that
Yeah.
violence is normal. It's something that those folks over there deal with, and that's something we radically want to change. We want people to, when they hear about shootings, they should think, how do we get to the lion's share of those who are experiencing violence? What can we do? And the answer is invest, and invest at scale. So that's what we promote.
And on that note, Fatima, I know that your group is part of a coalition that's putting forth a $5 billion plan to combat some of this. So if you could explain to listeners and viewers just what that is and what it would entail.
Absolutely. I'm really proud at the hobby to be a part of a larger coalition, a Fund Peace Now coalition that is led by Black and Brown led organizations that focus on community gun violence. And first of all, we are starting with our current president, who, as a candidate, has actually spent much time over the years talking about and learning about these programs. So, in Biden's plan on the campaign trail addressing gun violence, he included a $900 million commitment to investing in gun violence prevention strategies that I mentioned, these comprehensive public health approaches. But when we look, and this is over an 8-year period, right? So 900 million spread out over an 8-year period. But when we look at the actual burden of violence on our society in that same period, we're talking over $2 trillion. And so we say when we look at what it would take to do this sort of investment, 5 billion is a rounding error, quite frankly, and to invest that money up front. And again, we would take that 5 billion and distribute it over 8 years. We have a remarkable opportunity to provide relief for cities who've seen astronomical spikes in violence due to the COVID pandemic last year and are in dire need of relief.
And I'm wondering if you could sort of talk about the level, the amount of trauma, that these communities are going through and how that's being addressed. I can't imagine just seeing some of these horrific numbers of just the number of shootings. I think it jumped by 4,000 in 2020 compared to 2019, and we're seeing another sort of spike this year. So can you just talk about addressing, because it is a public health crisis, as you say, addressing the trauma that people who are either impacted personally, but just on the periphery, and how to deal with that?
Absolutely. I'm a trained psychotherapist, and we think very much about the trauma. So you have to understand that when we talk about violence, as it's not just the person's family. If someone's killed, there are a number of non-fatal shootings, meaning people who've been shot and they survive, and they're going back into the community with tremendous PTSD.
Yeah.
There have been studies that show that the level of PTSD we see in some of our Black and Brown neighborhoods rival that we see in war, right? Among those who are actually on the battlefield. So we're talking about escalated levels of trauma, and left untreated, it can really change the brain. So there's a lot of brain science that looks at the impact of trauma, prolonged trauma, particularly for children who are exposed to trauma. And it has incredible impact over the life course. So it is not only the right thing to do. Science backs up intervening and actually providing healing to ensure that people have. I mean, that's the good news, right? That this is
Yeah.
not destiny. That if you experience trauma, and I'm a trauma survivor myself, that if you've experienced trauma, there are things that you can do, and education about what you can do is incredibly important, and providing the support is critical. What's powerful about these comprehensive approaches is that it focuses on how we can get at the root. So
Hmm.
it's not only addressing the trauma by leveraging people from the community, hired from the community, who are credible messengers, who have themselves experienced trauma, who've seen it, and can share as a peer, as someone who's been there, say, I've been through this. It gets better. Here's what we can do. But they also provide services. So housing, transportation, looking at employment opportunities. So it's connecting not only the trauma care, the therapeutic services, but also very concretely, what can we do to actually transform lives in the long term? So we think about trauma in a comprehensive way, because the trauma we've experienced, right, disproportionately, this is really critical. The communities that are experiencing this trauma, right, are the same communities that have experienced economic divestment, right,
Hmm.
lack of housing,
Yeah.
lack of food support, food deserts, redlining, right? These are the same communities. So that's a level of kind of what we call systemic trauma, systemic violence. And so we want to make sure that we have a therapeutic response, but also a systemic response to the needs of those who experience this level of trauma.
And Chris, I think, oh, there he is. I think
Um,
Chris has another
sorry
question.
about that. Sorry about that. Yeah. I just want to revisit to underscore that horrific statistic that you spoke about, and also it's on your material for your plan, that the number one killer, really, of African American men and boys is gun violence. The second It's the second most killer for Latino men and boys and African American girls. I mean, just as we're talking here, I think about something like cancer, or heart disease, and it's the number one killer. And what do? They pour billions, hundreds of billions of dollars. Everybody knows it. Everybody gets together to try to fight it. And then you see something like this that just does not get the attention it deserves. So I was just wondering if you could just underscore how this is a health crisis, and it should be seen that way, and it should be acted upon that way.
It is not only a health crisis, it's an emergency, right? And it's been one raging in our communities for decades. My own father, who's been in and out of prison most of my life, had a gun put to his head when he was a teenager, right? Living with that kind of trauma. That's where it begins. And that we've had this profound neglect given the public health crisis, given this public health emergency, I think is incredibly problematic. But there is an opportunity today. Um, the Biden administration and President Biden has an opportunity today to do something historic, to begin a new paradigm of addressing this issue, so that we can look forward and see significant reductions, and not only reductions, but also see young people transform their lives and be put on paths towards new prosperity, thriving, because we don't want to just end with did they or did they not commit a violent act or be injured. That's not enough. We want to talk about people who have incredible potential to contribute to society being given a shot. That's what we're talking about. They're given a chance to do what they want to contribute to society. That's what the opportunity is. And we think that we're encouraged by the way the administration has at least listened, but we are now hoping to see a real concrete, bold action and an investment of $5 billion in this effort.
And Fatima, I just have one last question, if you don't mind. And it's sort of on our podcast and on this show, we talk a lot about mass incarceration and the criminal justice system. And we've done episodes on restorative justice and alternative programs such as those. And just when I hear about the initiatives that and strategies that your organizations and others employ to combat sort of violence and addressing harm, the people who have been harmed, and then sort of restorative justice, which is mediating after something terrible happens. So, do you see your efforts as sort of part and parcel of a larger effort to invest, like well, they say defund police, but taking that money, investing in communities, and using all this for resources across a huge scope to address what's happening?
We are absolutely a part of an infrastructure, a new paradigm for the way that we can address challenges further upstream. A public health approach means we can actually go further upstream. We can identify those who are at risk. We can wrap them up with love, with support, with intervention. Work with them to reimagine their lives and leverage a workforce that has lived this work, is from the community. So they are seeing the people who are helping are people who look like them, right? We can do that level of intervention, and then we can continue to monitor their growth over years. We are not the only program. That's why I like calling it a comprehensive infrastructure, because I think it better communicates that we're talking about something robust that wraps around folks. So you mentioned incredible work that's happening in the restorative justice movement. We work on the hospital-based side because we know that people who are getting shot are going to the hospital, but we have our street outreach programs that are doing work out in the community before someone gets shot. We have peace fellowships that invest in those who are at highest risk, helping them support them build out a life map for their work, intensive life coaching. I mean, there's incredible, really robust, innovative work that's happening, and cities across this country are already beginning to invest. They need the support of the federal government to bring them to
Yeah,
scale.
definitely.
Hi, I just want to jump in. It's Manny Faces. Are you in New Jersey? Did I
I'm
get that?
currently in Jersey City. Yes.
Okay, I'm in Newark, New Jersey. Brick City represent.
Wonderful.
And I was going to ask you a question, but just to jump in on your last point, I know that the New Jersey Institute for Social Justice, for example, working with youth prisons, there was some legislature that's kind of milling about trying to start a pilot program to help young people getting out of those situations get acclimated back into life. And these are the kind of community-based programs you're talking about that are happening on local levels, on state levels, that we just need to get more attention to on a national level.
Absolutely.
My question is, and we have links to the report and to your organization, and thank you so much for doing this. Are there things that the public can do? For example, I know for New Jersey Institute for Social Justice, they had a, call your congressman, that whole kind of campaign going on. What can the public do if they're interested in your plan, your organization? What's the best thing that they could do to help out?
First of all, I believe you must call your congressman, call your senator, and ask them about what they are doing in Congress to promote and support investments in Black and Brown communities. Right? Are you supporting funding peace? That is critically important. We ask that you come to social media. Hashtag Fund Peace. You can find us there. You can also go to at the hobby. You can follow us, and we can kind of point you to resources and a whole host of others in our coalition who are doing this incredible work. Those would be incredibly important for us right now. We need to continue to apply pressure. Our website, www.thehobby.org, has this plan to fund peace that our coalition has worked on. It really breaks down the numbers, but right now we need Congress to act, and every person that makes a phone call, that puts out a letter that says that fund peace is important, we will have a drumbeat of people who say this matters, right? Black lives matter, Brown lives matter. We all matter, and this is an opportunity for us to contribute. Again, historic level of investment, given this public health emergency that rages on.